tachycardia, hyperthermia, hypertension, mydriasis. Then there are extreme stimulation of heart, which can lead to arrhythmia and MIE. Then CNS stimulation. So CNS stimulation, CVS, cardiac stimulation is very high. MIE, death can occur. Chronic poisoning, one is black tongue and teeth. Please remember, in sulfuric acid poisoning, tongue is black, but teeth are chalky white in color. Okay, in tactile hallucination occur. Person feels as if insects are crawling under the skin. This is called cocaine bug or formication or Magnan symptoms. Magnan symptoms. Okay. Then Dhatura, also called thorn apple because of spines. It's also called hell's bells or devil's trumpet because trumpet shaped flowers. It's also called railroad poison or platform poison because given to the passengers, they become delirious so that they are robbed away of their belongings. Okay, these are the active principles. So the symptoms are all anticholinergic symptoms will be there. So various D's occur, like D for the dilated pupil. Okay, all anticholinergic pupil. Diplopia also occur. Delirium, if you start from above, delirium. Then here the body is dry mouth. Mouth becomes dry, all secretion dry. Because of the dry mouth leads to dysarthria, dysphagia, dysphonia. Okay, all these are dry, hot skin. Then there is dry, hot skin, that is fever is there, fever. Please remember all the D's occur, but D for diarrhea does not occur. It causes constipation. Okay. Now please remember that if we talk about the insecticides, we have organophosphates, we have carbamates. Whenever in a compound you see phos or on, so phoson is organophosphate. So phos or something which ends with on. So phos and on, phoson is organophosphates. Carbamates, you remember, carbs are mine. Carbamate. Okay. Treatment we have discussed. Okay. So now let us start with in toxicology, we have done with the general toxicology. We are done with the toxidromes. Now let us start with the third subtopic, that is corrosives. Corrosives, basically we have strong acids and strong alkalis, and in strong acids we are further subdividing it into inorganic and organic. So please remember the organic acids like oxalic, carbolic, acetic and formic. These acids are basically weak corrosives as compared to the inorganic. So inorganic acids, because they are weaker, relatively weaker, so sometimes we can cautiously do gastric lavage here. Okay, cautiously, especially we can do gastric lavage in carbolic acid, especially in carbolic acid we can do it. Okay, because it makes the stomach wall hard and leathery. Now, acids versus alkalis. C for acid, so it causes coagulative necrosis. Alkalis, L for alkalis, it causes liquefactive necrosis. Eschar is a hard tissue. It is produced because coagulative necrosis occurs in acidosis, so it occurs, eschar formation occurs in acidosis, not in alkalis. Depth is much more in alkalis because of liquefaction and less in acids. So that's the reason alkalis are more severe and acids are less severe. And please remember, as stomach already has acid, so more acid goes, more damage to stomach. So that's the reason acid causes more damage to stomach, because stomach already has acid. This is how you can remember. And alkali causes more damage to esophagus. Now please remember that the inorganic acids and alkalis, they usually have only local effects, but the organic acids, they have both local and systemic effects because they get absorbed in the blood. Now, so severity of local corrosive effects, here please remember it is maximum in alkalis. Local corrosive effects are maximum in alkalis, followed by inorganic acids, followed by organic acids. Please remember, usually acids causes coagulative necrosis, but hydrofluoric acid is an exception. Hydrofluoric acid is an exception, which is acid, but still it causes liquefactive necrosis. And similarly, remember that normally inorganic acids normally cause only local symptoms, but hydrofluoric acid is one acid which is inorganic but which have systemic symptom also. Okay, so these are the two things characteristic of hydrofluoric acid. Now, the common features you need not remember: pain, pain in chest, pain in neck, pain in abdomen, nausea, vomiting, all these things will occur. Then please remember, HCl, you remember HCl is already in the stomach, so it must be relatively less corrosive, less poisonous, otherwise it would not be a part of stomach. This is how you can remember. So here the fatal dose is 15 ml, here the 10 ml, and here the 5 ml. So the corrosive effect is maximum in H2SO4, then HNO3, then HCl. Vitriolage, throwing off acid, because H2SO4 is more corrosive, so for vitriolage we usually use H2SO4 more. Stomach perforation, because it's more corrosive, it will occur more commonly in H2SO4. Please remember, these two, nitric acid and HCl, they are fuming, but not sulfuric acid. Okay, so this is one thing which is more common with nitric acid and HCl as compared to sulfuric acid, that because they are fuming, so they will cause respiratory tract inflammation as compared to H2SO4. Now, please remember, sulfuric acid, because it's highly corrosive, it causes effect on everything: teeth, skin, mucous membrane, all of them. HNO3 will also cause effect on all three. HCl will have no effect on teeth and no effect on skin, but it will have an effect basically only on mucous membrane, because mucous membrane is much more easier to damage as compared to teeth and skin. So while H2SO4 and HNO3 has effect on all teeth, skin and mucous membrane, HCl has effect only on the mucous membrane because it's less corrosive. H2SO4 makes the teeth chalky white, as you can see, and HNO3 everything becomes yellowish in color. Yellow teeth, yellow burns, yellow skin burns, and yellow mucosa. Okay. In H2SO4, the skin becomes blackish and mucous membrane also becomes blackish. And HCl, here no effect, and here the mucous membrane, here also it becomes blackish. And also remember that in sulfuric acid poisoning, the stomach becomes like a blotting paper. Okay. So magentras is the path taken by, so that means acid flows through lesser curvature in stomach. This path is called magentras. So during the autopsy, open through greater curvature so that you can easily see the lesser curvature. So B for boric acid, B for boiled lobster. So boric acid causes boiled lobster-like appearance, like there will be erythema and desquamation. Then oxalic acid is a plant-based poison. So that because it's a organic acid, so it will have both local and systemic effects. So mechanism of action is somebody takes oxalic acid, somebody ingests oxalic acid, suppose, then this oxalic acid, what it will cause? It will cause GI corrosion. Okay, there will be bleeding will occur. Bleeding in stomach will occur. This blood in stomach, it will react with the hydrochloric acid of stomach, which is already there, which will lead to formation of acid hematin. This acid hematin, it comes out as a coffee ground vomitus. It comes out as a coffee ground vomitus. So it is vomit when the vomitus comes, that is coffee ground in color. So that is one of the characteristic feature of oxalic acid poisoning, that it causes coffee ground vomitus. And then finally what happens is this oxalic acid get absorbed into the blood. In the blood, oxalic acid combines with the body calcium. It combines with the body calcium to form, this leads to hypocalcemia. So various features of hypocalcemia occurs. And then also remember that this leads to the formation of calcium oxalate crystals, and these oxalate crystals come out in the urine. Okay, and please remember these crystals can also lead to acute renal failure by direct toxicity on the renal tubules. Please remember that hypocalcemia. Please remember that hypocalcemia. And accordingly, the treatment by calcium gluconate treatment. So hypocalcemia is seen in HOE. What is HOE? H for hydrofluoric acid, O for oxalic acid, E for ethylene glycol. Okay, please remember that hypocalcemia or calcium gluconate for hypocalcemia, and according to the treatment by calcium gluconate is seen in HOE, hydrofluoric acid, oxalic acid, and ethylene glycol. And please remember that calcium oxalate crystals in urine is seen in OA. Okay, oxalic acid and ethylene glycol. Oxalic acid and ethylene glycol. So hypocalcemia and calcium gluconate in HOE, calcium oxalate crystals in urine in OA. So easy to remember, OA and HOE. So coffee ground vomitus, coffee colored vomitus. Then please remember all these three are the signs of hypocalcemia which occur in oxalic acid poisoning. Here what happens is transducin, double S. So when you give pressure, the hand cramps occur like this. Okay, then this Akershaw's hand, and when you go do tingling on the face, when you do tingling on face, then the facial spasm occurs. So just remember, Traju, Akershaw's and Shawastek signs are seen in oxalic acid poisoning because of hypocalcemia. Carbolic acid is also called phenol, and the derivatives are lysol and ditol that we normally use. It is used as disinfectant and antiseptic. Okay, antiseptic. It has characteristic phenolic odor. It has characteristic phenolic odor. A poisoning by carbolic acid, poisoning by phenol is called carbolism. Now, they can be acute poisoning and local chronic poisoning. Acute poisoning, there can be local effects and systemic effects. Now, please remember, carbolic acid has few characteristic features. First of all, it acts as a local anesthetic. Okay, so initially there is pain, but eventually it becomes painless because it acts as a local anesthetic. Then it causes bleaching of the tissues. So whitening occurs. Whitening of tissues occur. Whitening of, and it makes the tissues hard. It makes the tissues hard. These are the characteristic features of the skin. Also, you can see white, hard eschar is formed. This hard is initially there is pain, but eventually it becomes painless. Okay, in the GI also the tissues become whitish and hard. Whitish and hard. So the reason that here, because the stomach becomes hard, so we can do the gastric lavages can be done. Okay, then the acute, these are the acute poisoning local effects. Now when it gets absorbed, what happens is that it is basically a depressant to CNS depression occurs. Then what happens is carbolic acid in the body, it disintegrates into pyrocatechol and hydroquinone. These compounds, they come out in the urine Okay, and then the urine becomes green in color. The urine becomes green in color. This is called carboluria. Carboluria. Okay, so these are the acute poisoning systemic effect. Now the chronic effects of carbolic acid poisoning. Phenolic marasmus occur. Phenolic marasmus is characteristic. It occurs because of the malnutrition. Phenol causes marasmus. And second thing is same compounds, that is oxalic acid disintegrating into pyrocortical and hydroquinone. These substances, they deposit in the body tissues to cause blackish discoloration. This blackish discoloration is called ochronosis. This blackish discoloration is called ochronosis. Okay. Then treatment, general treatment of all corrosives. This point is applicable to all as strong acids plus alkalis, all corrosives. Okay. General thing. Please remember, usually NEG should not be done. NEG is usually contraindicated in NEG is contraindicated in corrosive. N for neutralizing agents. Okay, like for acid, don't use alkali. For alkali, don't use acid. Okay, then activated charcoal is not allowed. Gastric lavage is not allowed. MSS is not allowed. As I told you, the exception is carbolic acid and sometimes other organic acids. That may be done cautiously. So NEG is usually not to be done in corrosives, and double D is to be done with caution. Plus minus I will write. NEG is totally cross and the double D is plus minus. D for dilution. For example, using water, milk to dilute. Or D for demulcent, like we can use butter. Why with caution? Because if it is too much in amount, then that can lead to vomiting. Too much in amount can lead to vomiting. The person should be kept nil per orally for a week, and then we have to give other symptomatic treatments. Okay. Now, please, so this we have already told, calcium gluconate as a treatment. Now, coming to irritants, they are metallic, non-metallic, plant-based, animal-based, and mechanical. So heavy metals are very commonly asked in your exam. Let us discuss. Please remember, in general, all the heavy metals are basically GI irritants. So they will cause basic features of GI irritation like nausea, vomiting, pain, abdomen, pain, chest, pain, throat. All those kind of features are going to occur. Please remember, usually heavy metals cause diarrhea. But there is an exception. Please remember, lead, remember the mnemonic, lead leads to constipation. So, lead causes constipation, and C for constipation, C for cadmium. So, lead and cadmium causes constipation. Now, please remember, you can see vomiting can occur in any heavy metal poisoning, but in copper, the copper causes blue vomiting, and which is very much larger amount. So that is characteristic of copper. Blue color is characteristic with copper. Now, like diarrhea can occur in multiple heavy metals, but in arsenic poisoning, the diarrhea is characteristic. Initially, it is bloody, and later on it becomes rice watery. That is the reason that it is called that arsenic resembles cholera. So basically, most of the heavy metal acute poisoning, they look like gastroenteritis. Most of the heavy metal acute poisoning looks like gastroenteritis. Then, please remember, the most toxic substance of arsenic is Sankhya. Okay, also simply the chemical name is arsenic trioxide. And please remember, arsenic do not remain in blood for a long time. It gets distributed to other body tissues. It do not remain in blood to the long time. It gets distributed to other body tissue. It is deposited in all body tissues except brain. So you can remember that blood and brain are not good to detect arsenic. Okay, the highest concentration is found in liver, followed by kidney. But it is found for prolonged period in keratinized tissues like skin, hair, nail, bones. So these are the tissues that should be preserved in case of arsenic poisoning. And please remember, it's a common homicidal poison. The acute poisoning can be acute or chronic. Acute poisoning can be fulminant, narcotic, or GIT. Fulminant, the person dies rapidly. In narcotic type, there are mainly neurological effects seen. GIT type is most common, gastroenteritis kind of feature, which I told you, diarrhea occurs, rise watery color diarrhea, and it appears like cholera. So that we have seen. Now coming to chronic arsenic poisoning, peripheral neuropathy. Please remember that arsenic, thallium, mercury, and lead, all of them can cause heavy metal, all of them can cause peripheral neuropathy. But the main difference here is arsenic, mercury, and thallium, they basically causes sensory neuropathy more, followed by motor and less of motor. Lead causes more of motor neuropathy and less of sensory. And please remember, thallium causes very painful neuropathy. Okay, now skin symptoms are characteristic in arsenic poisoning. It causes hyperkeratosis of palm and soles. And then there is, you can see small drops. So this is raindrop pigmentation. Okay, then whitish opaque lines that you can see, these are Eldritch Mees lines. Eldritch Mees lines are seen in arsenic and thallium. Okay. Now hairs, remember the mnemonic, hair on mat. That means alopecia is seen in mercury, arsenic, and thallium. But please remember, alopecia is extremely characteristic of thallium poisoning. Black foot disease, it's a kind of peripheral vascular disease. Peripheral vascular disease can be seen in other heavy metals also, but here it is characteristic. It can lead to gangrene. In others, it is not that much severe. So black foot disease is characteristic of arsenic. Arsenophages are those who can tolerate large amount of arsenic. Okay, it delays putrefaction, and in the stomach there is a red velvety appearance because of the microhemorrhages you can see. Okay, then thallium, please remember, arsenic and thallium have 90% similar features. All these features which occur in arsenic occur in thallium also. The main characteristic feature is, see, alopecia can occur in arsenic, but in thallium it is much more severe and characteristic. Neuropathy occurs in both, but in thallium it is very painful. Very painful. GI symptom can occur in both, but in arsenic it is more common. Okay, and both of them can be used for homicidal poison. So these are the few differences. Please remember, thallium treatment is unique. How? Because here, please remember, here we don't use chelating agents. Usually in heavy metals, we use chelating agents, but here we don't use chelating agent. In heavy metals, we don't use activated charcoal, but in thallium, we use activated charcoal. In fact, we use multi-dose activating charcoal. And here we have a special antidote, that is potassium ferric ferrocyanide. And please remember, if we remove the word ferric and we use only potassium ferrocyanide, that will be an antidote for copper. Mercury, chronic poisoning, hydrargyrism. The tremors are partially coarse. They start in hands and then they spread to rest of the body. These tremors are called Danbury tremors or Hatter's shakes or glass blowers shakes. Okay, when these tremors to spread to whole of the body and absolutely no activity is possible, that is called concussio mercurialis or shaking palsy. Okay, then in the mouth is metallic taste, increased salivation. Gingivitis is very characteristic of mercury poisoning. Blue line on gums, that is Burton's line. Burton's line is characteristic of lead poisoning, but it is also seen in MCI. M for mercury, C for copper, I for iron. Okay. Erethism, mad hatter, because in the hat making industries, mercury was used. It's the neuropsychiatric symptoms seen in mercury poisoning. The person becomes shy, irritable, his personality changes. Personality changes. Mercurial lentes is a deposition of brownish mercury vapors on anterior lens capsule in both the eyes. It has minimal effect on visual acuity. Okay, kidneys, membranous glomerulonephritis, and it causes colitis which resembles diphtheric colitis. Okay, acrodynia or pink disease is the chronic mercury poisoning in children. The limbs become, it's a kind of delayed hypersensitivity reaction to mercury. The limbs become pink, puffy, painful, and paresthetic. Okay, Minamata disease is it occurs due to organic mercury. Organic mercury, that is like methyl mercury. And here, please remember, the organic mercury, the key characteristic is that the neurological features, example, ataxia, they predominate. Neurological features predominate. Chronic lead poisoning. A for anemia with basophilic stippling. Anemia is microcytic and hypochromic. Okay, basophilic stippling, it occurs in the RBCs. In the RBCs, there are blue dots, blue granules. These blue granules are called basophilic stippling. And what are these blue granules made of? These are aggregates of ribosomes. So please remember, lead inhibits 3 enzymes in heap synthesis. One is ALAD is the most important. So very easy to remember. Lead inhibits ALAD. Easy to remember. Then copropyrifosinogen oxidase and ferrochelatase. These are the 3 enzymes inhibited. Then B, A have told lead is A for anemia with basophilic stippling. B is Burton's line, bluish line on gums, at the junction of gums and teeth. I told you it's seen in lead, but also can be seen in MCI. And B for bone line. It is bone line is seen on the metaphysis of the long bones. It is seen in the metaphysis of the long bones. Then C for colic and constipation. D for drops. There is foot drop and wrist drop. That is lead palsy. Lead palsy is a late feature seen in only 10% of the people suffering from lead poisoning. E for encephalopathy. Encephalopathy is an early feature seen in most cases of lead poisoning. F for facial pallor. Facial pallor is the earliest feature. It is perioral. So probably the reason is vasospasm. Please remember, lead poisoning is much more sensitive for children because their brain is developing and encephalopathy affects them severely. Then please remember one thing, that blood is the best test for lead, detection of the lead poisoning in a living person. I'm talking about in a living person, to diagnose lead poisoning, use blood. But for arsenic and thallium. Arsenic and thallium, the best is urine. I'm talking about a living person. Okay. So just remember the treatment we have already told you earlier. Copper, vitriol. Blue vitriol is copper sulfate. So blue color is associated with copper. And oil of vitriol is H2SO4. So both has SO4 in them. Okay, this is blue vitriol. Acute poisoning, that there are two characteristic features. One I told you is the large amount of blue vomit. Apart from the usual features of GI irritants will be seen, I am telling the characteristic feature. And said the other is copper causes hemolysis, acute hemolysis. These two are characteristic feature. And chronic poisoning can be either ingested or inhaled. The ingested poison, the copper deposits in various body tissues. That is called chalcosis, and this is especially common if the person also has the Wilson's disease. Basically, copper gets deposited in three organs: brain, liver, and eyes. In the eye, it causes KF ring. So you can see this is KF ring, Kayser-Fleschner ring. It occurs in cornea and it occurs in copper. So easy to remember: K for copper, K for cornea, K for KF ring. And if inhaled, then it causes special kind of interstitial lung disease that is called Vineyard sprayer's lung disease. Barium is used as a rodenticide. I'm talking about the toxic compound. Non-toxic is of course used in radiology and all. I'm not talking about a toxic compound like barium carbonate, barium chloride. They are used as rodenticide, and their characteristic thing is that they causes hypokalemia and paralysis. Hypokalemia and paralysis. Okay, these two things, whenever you see hypokalemia, always think of barium carbonate poisoning. Cadmium basically affects bones and kidneys. Okay, these two things are especially affected in cadmium, bones and kidneys, and so it is very painful. Cadmium affects bone very severely, so it's very painful. So it's also called ouch disease or itai disease. Metal fume fever occurs basically due to ZAM, zinc, aluminium, or magnesium poisoning. There is malaria-like or flu-like symptoms which resolve in 24 to 48 hours. Then phosphorus. White phosphorus is toxic, red is not toxic. White phosphorus becomes yellowish on exposure to air. It looks like translucent, waxy cylinder, whereas red phosphorus is powdery, amorphous, powdery. Okay, it is kept underwater because it undergoes spontaneous combustion, whereas red phosphorus does not undergo spontaneous combustion, but only if some heat is applied. Only then red phosphorus or some spark is given, then it will burn, not spontaneously. And it has luminosity. It glows in dark. Okay. Then please remember acute phosphorus poisoning and we have chronic phosphorus poisoning. Acute phosphorus poisoning can occur by contact or by ingestion. If it occurs by ingestion, then there will be both local symptoms as well as systemic symptoms. The contact basically causes yellowish burns. So whenever you see yellowish kind of skin, yellowish feature is seen in basically in HNO3. You remember they were yellowish burn, and in phosphorus. Local, it has a very characteristic garlicky odor. Remember, garlicky odor was seen by Topa. Okay, in the GI, what will happen is, first of all, general, it will have some corrosive effect. It has some corrosive effect on GI. So basically it has all the, you don't have to remember separately. It will basically have all the corrosive, vomiting, diarrhea, all those things are going to occur in acute effects on GI. Then vomit and feces, what characteristic effects must occur is, first of all, they have a garlicky odor. Garlicky odor will occur in vomit and fumes. Then because it's luminescent, they will glow in dark. Vomit and fumes will glow in dark. And also what happens is fumes occur. So fumes occur from these, especially from the feces, the fumes occur. So that is called smoky stool syndrome. Okay, and then systemic, the main feature is it is hepatotoxic. The liver becomes soft, yellow, fatty, enlarged. Okay, that's the characteristic feature. Chronic phosphorus poisoning occurs due to inhalation of fumes. It can lead to phosphago. It used to occur earlier, but not now, because now in the matchstick we use red phosphorus. There is osteomyelitis of lower jaw. Okay, color of postmortem staining in both phosphorus and copper poisoning, it is dark brown or yellow. And please remember, for phosphorus, so very easy to remember, phosphorus. So phosphorus has 4, so it uses KMnO4 and CuSO4 is the treatment. CuSO4 itself is a poison, but so it is not commonly used because it itself is a poison. Animal irritants, snakes and spiders, scorpions, Spanish fly. Spanish fly is also called cantharides. Cantharides. Please remember that spider, scorpion and Spanish fly, these can lead to priapism. That is painful long erection. Snake poisoning is very common. Aphytoxia is poisoning by snake bite. Very commonly asked. They are based upon the main clinical effects: neurotoxic, vasculotoxic, hemotoxic. Vasculotoxic also called hemotoxic. Neurotoxic basically causes paralysis. So especially you will see ptosis and respiratory failure due to paralysis of respiratory muscles. Okay, hemotoxics, there is consumption, coagulopathy. And this coagulopathy leads to bleeding. And apart from bleeding, because of the bleeding, there is acute shock. Person goes into the shock, which leads to acute renal failure. Myotoxic, there is myoglobinuria. This myoglobinuria leads to acute renal failure. So acute renal failure occurs in both. Bleeding occurs in vasculotoxic. Paralysis occurs in neurotoxic. Please remember then snakes belonging to these categories. In neurotoxic, we have cobra and crate. Vasculotoxic, V for vasculotoxic, V for vipers. Which all vipers are common? Russell's viper, saw-scaled viper, and pit viper. Please remember these first 4: cobra, crate, Russell's and saw-scaled. These are the common found in India, the big 4. The myotoxic is sea snake. Okay. Please remember one thing, that Russell's viper is basically vasculotoxic, but it also has some neurotoxic features. Please remember, usually poisonous snakes are very painful. They have severe local symptoms, but there are 2 exceptions. That is crate and sea snake. These are poisonous but have minimal local symptoms. Most painful are vasculotoxic. Okay. So if there are mainly neurotoxic symptoms, so that means it will be cobra or crate, but with significant local symptom, that means it's cobra. Neurotoxic symptom with minimal local symptoms, it will be crate. Vascular symptoms only, no neurological symptoms, saw-scaled viper. And both vasculotoxic and neurological, it will be Russell's viper. Okay. Management. The field management has minimal role in snake bite. In many conditions, the field, the first aid has a great role, but not in the snake bite. Main role is given by the main treatment is by the anti-snake venom. The anti-snake venom is polyvalent. It contains anti-venom against all the big 4 snakes found in India. So it does not contain anti-venom against pit viper. It does not contain anti-venom against the pit viper, but still it can be partially effective. Though it does not contain anti-venom against the pit viper, still it can be partially effective because of the formation of the cross antibodies. Okay, so this is the main treatment that you will have to give whenever the poisonous snake bite is affected. But in addition to the anti-snake venom, what additional things you are going to give? In case it's a neurotoxic snake, then you will give neostigmine plus atropine also. The antidote is neostigmine, but we give atropine also to take care of the muscarinic side effects of neostigmine. So here the neostigmine and atropine combination is much more useful for cobra, okay, as compared to crate. Cobra, it is much more useful because it crate the poison is presynaptic. Ventilatory support is given for neurotoxic because they cause respiratory muscle paralysis. Dialysis can be done for both vasculotoxic as well as myotoxic because both of them cause renal failure. Blood transfusion will be done for vasculotoxic. Okay. Now, first aid treatment has limited role, but still if we have to talk about it, it's of 3 types always to be done. RIB, R-I-B, reassure the patient. Many people die just because of anxiety. Many snake bites are non-poisonous. Immobilize the limb so that the venom does not spread and keep the limb below the heart level. So this is immobilization and this is keeping the limb below the heart level. And then this and the second category is plus minus, that may or may not be pressure immobilization and cleaning with soap and water. So cleaning with soap and water has great role in rabies, but here the venom which has gone, it's gone. Moreover, when you will clean with soap and water, there will be danger of spreading of the venom. So it is plus minus. Now when it comes to pressure immobilization, I will like to tell you one thing. So let me just reiterate. So one is when immobilization is always to be done. So okay, second point is pressure. Pressure can be of 2 types, light pressure and tight pressure. Tight pressure is typically given by tourniquet. How is light pressure given? Light pressure is given when on the some immobilizing splint, you add a bandage. That it is typically a light pressure. For example, here you see, here this is the splint and on the splint you are adding the bandage. This is a kind of light pressure. Okay, so please remember the light pressure which is given by immobilizing splint plus bandage, this is plus minus, may or may not be done. Tight pressure by tourniquet is never to be done. Light pressure is why it is plus minus, because if it is a vasculotoxic snake, then don't give any light, even the light pressure. Just do the immobilization, but don't even give the light pressure. In case it's new, because vasculotoxic have a strong local toxic effect and that can lead to amputation of the limb. And if it is neurotoxic snake, then you can give the light pressure. Okay. Then please remember, tight tourniquet, incision and bitten area, topical chemical, sucking the venom with mouth, nothing of that sort has to be done. Now, the main question which comes is whether the snake poisoning treatment in the form of anti-snake venom is required or not. So typically people think there are three main conditions by parameters. One is this, whether sign of poisoning is there or not. Second is bite mark. Third is snake identification. Please remember, this is the best way to decide whether there are signs of envenomation or not. Because with the bite mark and snake identification, you can get to know whether it's poisonous snake. This you can get to know whether it's poisonous snakes or non-poisonous snake. But the problem is, even if it is poisonous snake, the bite may have been without venom. Bite with venom. The problem is this: with the bite mark and snake identification, you will simply be able to know that it was a snake, a poisonous snake, but you will not come to know whether in that bite actually venom was present, because the bite can be with venom or without venom. There can be a dry bite. That venom might not be present even if it was a poisonous snake. Okay, venom might not have gone. So signs of envenomation are the most important. So on the basis of sign of envenomation, you see whether there are local signs or systemic signs. Any systemic sign, if there, like bleeding, paralysis, that indicates it's a poisonous snake, then you give anti-snake venom. If it is only local sign, no systemic sign, if it is only local sign and no systemic sign, then you see whether signs are severe or mild. Severe means it's a poisonous snake and you give anti-snake venom. If it is only mild sign, only mild local symptoms and no systemic symptom, then probably it's a non-poisonous snake bite. Don't give anti-snake venom, but observe the patient for 24 hours. Okay. So this we have discussed. It's a bedside test. It's a bedside test. That's the reason it is not a very accurate test. Please remember, the PT-INR, they are better. But the thing is, it is bedside. It can be done easily for vasculotoxic. You take the blood sample and you keep it for 20 minutes. So here you can see the clotting has occurred. Clotting occurred. Here clotting has not occurred. So this is a case of vasculotoxic bite. Okay, and this is normal. So this we have discussed. Identification of snakes. Remember one mnemonic, BLP. That means B for belly. Belly scales are L for large in poisonous snakes. BLP. Belly scales are large in poisonous snake. So that means they are small in non-poisonous. Head scales are opposite. Head scales are small in poisonous and large in non-poisonous. But then there are certain exceptions. That is cobra, crate, and pit viper. Though these are poisonous snakes, but still they have large head. These three have large head scale. These three have large head scale. These are exceptions. Please remember, poisonous have two long fangs and multiple small plus normal small teeth, whereas the non-poisonous have only small teeth. Okay, so you can see here will be in poisonous snake there will be two bite marks with like this, and whereas non-poisonous it will be like this it will be seen. Okay. So here you can see, whenever you can see alternating dark and light bands, alternating dark and light bands, that is crate. Alternating dark and light bands is crate. Okay. So this is Spanish flybite. This is canthrides. Canthrides. Now for scorpion, you remember that scorpion, suppose this is the mouth of scorpion and then this is the tail. The scorpion injects the venom through the tail. It injects the venom through the tail. Scorpion bite is extremely painful. It is extremely painful but less fatal. One of the characteristic features of scorpion bite is it causes catecholamine release. So you can see, especially you will, whenever in the exam you see very high heart rate, that is the characteristic feature. And other sympathomimetic feature can also occur like increase in BP, sweating, etc. And here the main treatment is prazosin. Prazosin will take care of the catecholamine release. Then, now please remember, when it comes to plant irritant, the ricinus, croton, abrus, they have multiple names. Okay, but for remembering purpose, you should be knowing which all names they belong to. But when you have to, in general, remember, you remember them by single name. Otherwise, it will create confusion. For example, ricinus is also called castor. But in general, when you have to, you should be knowing that ricinus is called castor. But in general, we have it as ricinus, not castor. Okay, it's like this. So please remember that RCAR, toxalbumin. RCAR, toxalbumin. R for ricin, C for croton, A for abrus precatorius. And what are toxalbumin? Tox are those which are plant poison but which resemble bacterial toxins. So they lead to cytotoxicity. toxicity. Okay, so RCAR, toxalbumin, and please remember R and A have similar feature. They inhibit protein synthesis. Okay, same as R. R and A inhibit protein synthesis. Okay, inhibit protein synthesis. Both R and A inhibit protein synthesis. So that is the reason I can say that both R and A are extremely, ricin and abrus are extremely toxic. They can lead to multi-organ failure and death. C for croton is relatively less toxic. It has different mechanism. It causes activation of protein kinase C. It causes activation of protein kinase C. So C for croton, C is here. This leads to inflammation and cytotoxicity. Inflammation and finally cytotoxicity. Okay. SCP. SCP is, they cause artificial bruise. Semicarpus anacardium, Calotropis and plumbago. SCP causes artificial bruise. Then other plant irritants are capsicum and ergot. Please remember, in general, symptoms of all the plant irritants will be those of irritants depending upon the root. If it is oral, it will cause irritation into the throat, chest, abdomen, nausea, vomiting, diarrhea. If it is put on the eyes, it will cause conjunctivitis, inflammation in the eyes. Then in the skin, it will cause local irritation. Okay, dermatitis, it can occur. If it is injected, then again in the place where it is injected, it can cause local irritation. So general symptoms you don't have to rectify. These will be local general irritant features. What you remember is that ricin and abrus are extremely toxic. They can lead to multi-organ failure and death. Now, please remember that Ricinus communis is also called castor. Croton tiglium is also called Jamal Ghota. Abrus precatorius is also called Rati. Active principle in Ricinus communis is ricin. Croton, it is crotin. And abrus is abrin. All of them are toxalbumins. All of them are toxalbumin. Mechanism, actually, I told you, it inhibits protein synthesis. And this also inhibits protein synthesis. And croton tiglium, it causes activation of protein kinase C. C here, C for croton, which leads to inflammation and cytotoxicity. Characteristic point of ricin are, first of all, it can be used for as a biological warfare agents. Powder of ricin can be sprayed, which can lead to toxicity. Ricin was associated with umbrella murder. Umbrella murder. In the tip of the umbrella, ricin was applied and injected like this. Okay. And please remember, the ricin oil, that is, ricin is non-toxic. Ricin as such is very toxic, but in two conditions, ricin is not toxic. Which condition? When you use castor oil. Castor oil is non-toxic, and uncrushed seed. Uncrushed seed is non-toxic because it's very hard. The gastric juice is not able to digest it. In these two conditions, it is non-toxic. Croton tiglium, please remember that croton oil is toxic. Remember this, croton oil is toxic. It is used in Indian medicine for flatulence, dyspepsia, in Indian medicine. Abrus precatorius. Here, it is used to make suis or needles. The extract is used to make suis or needles. It is injected. When it is injected, it makes 2 bite marks. It appears like 2 bite marks. Lot of bleeding occurs from here. So it resembles viper snake bite. So one point is it used to make suis or needles. Second thing is it resembles viper bite. Okay. Then other plants, Semicarpus anacardium is also called marking nut. The active principle is semicarpol or bilavanol. It is used for, there are two things you remember. For one is artificial bruise, and it is used by dhobis for marking on the clothes. Capsicum anum is the lal mirch that we eat. It resembles datura. Two things you remember. It can causes painful contact dermatitis on continuous, which is called Hunan hand. Hunan hand. Then it is applied over here and inserted into the anus. This is a method of torture. It is called Hyderabadi goli. So H for capsicum. Taking lal mirch will cause ha. So H for ha for Hunan, ha for Hyderabadi goli. Okay. Then ergot. Ergot is, so this is fungi claviceps. It infects the rye. So this is rye plant. It infects the rye where it produces ergot. It produces a blackish substance called ergot. Okay. Fungi claviceps infects the rye. It causes a blackish substance called ergot. And when that is consumed, that causes poisoning called ergotism. Okay, and the main feature is it causes vasoconstriction. So it can be of two types. One is the convulsive, where it will cause multiple convulsions. Second thing is because it causes vasoconstriction, so it can lead to gangrene. It causes peripheral vascular disease in the extremities. So which can lead to gangrene, and there is lot of pain. Pain is there, pruritus is there in the extremities. So it is also called St. Anthony's fire. It resembles Raynaud's disease. Okay, now please remember these two are spinal poisons. Strychnos nux vomica is stimulant. Gelsemium is inhibitory. From exam, this is the main which is asked in your exam. Strychnine is obtained from Strychnos nux vomica. The active principle is strychnine, brucine, and loganine. Main is strychnine. Main body part affected is spinal cord. The mechanism of action is it causes post-synaptic inhibition of glycine, and glycine itself is a inhibitory neurotransmitter. So inhibition of inhibitory neurotransmitter leads to activation of lower motor neurons, which leads to muscle contraction, that is seizures. It leads to uninhibited muscle contraction, that is generalized tonic-clonic seizure. So here you can see this is interneuron Renshaw cell. Okay, and this is the anterior horn of the spinal cord. So the action is anterior horn of spinal cord. In the anterior horn of spinal cord, there is an interneuron, and it releases the glycine is released here. And strychnine acts over here. Strychnine acts over here. Strychnine causes competitive inhibition of glycine, does not allow glycine to act on the lower motor neuron. It does not act the glycine to act on the lower motor neuron. Whereas the action of tetanus is presynaptic. Okay, presynaptic. It does not allow glycine to get released. The most toxic part is seed uncrushed. It has to be uncrushed. The main feature is it causes generalized tonic-clonic seizures with consciousness intact. Okay. The main diagnostic feature is tetanus. Why? Because tetanus also causes the same generalized tonic-clonic seizures with consciousness intact. Because normally in generalized tonic-clonic seizures can occur in multiple conditions, but there the person becomes unconscious. Tetanus and strychnine poisoning are two conditions where the consciousness remain intact despite generalized tonic-clonic seizures. The onset is sudden. Okay, main feature is stimulant. So basically you can say is a stimulant of spinal cord. So how do you remember? S for seed is the most toxic, S for strychnine, S for seed, S for stimulant, S for spinal cord, S for it causes seizures, S for it causes seizures, and the onset is sudden. Again S for strychnine, strychnosinus vomica, S for strychnine, and then muscles are affected simultaneously here. In tetanus, they are affected gradually, one by one. In tetanus, they start from the lower jaw. In tetanus, the lower jaw is especially affected, but nothing like that in strychnine. Strychnine is all muscles, including lower jaw, all are affected simultaneously. In strychnine, the muscles are S for soft in between the contraction, and then they become completely soft. Contraction, completely soft. Whereas in tetanus, in muscles in between contractions remain rigid. Okay, so all S in strychnine poisoning. Then hyperextension of spine is in both strychnine and tetanus, the most common is hyperextension of spine, that is opisthotonus. Hyperflexion of spine is sometimes seen, which is called emprosthotonus. Lateral bending of spine is sometimes seen, which is called pleurosthotonus. Okay, these two are peripheral poison. Basically, they act at neuromuscular. They inhibit neuromuscular junction. Okay, which leads to flaccid paralysis. Flaccid paralysis. Okay, conium and curare. Cardiac poison. Remember the mnemonic DHONAQ. DHONAQ are cardiac poisons. DHONAQ. Okay, and when it comes to the oleanders, and please remember, out of these, remember one thing. Which one are the most are alkaloids, but 3 are glycosides. See, please remember, the glycosides mainly affect heart. Glycosides mainly have an effect on cardiac muscles, cardiac tissue. Okay, and which one are the glycosides out of these three? Digitalis purpura, and both the oleanders. These are cardiac glycosides. Others are alkaloids. Okay, all of them will cause hypotension, and arrhythmia is something which is common to all cardiac features. Please remember Q for QT prolongation. QT prolongation occurs by Q for quinine. Easy to remember. Hydrogen cyanide. Here what happens is, suppose this is the artery, and here we have the vein, and here we have the tissue. So here we have cytochrome C oxidase, that is the respiratory chain enzyme. Cyanide inhibits cytochrome C oxidase. So here we have HbO2. Okay, and then we have capillaries. We have. So we have HbO2. This HbO2 comes here. Oxygen comes here, but the cells are not able to use oxygen because of the inhibition of cytochrome C oxidase. So finally, when there is too much of oxygen in the tissue, but that is not being utilized, then this HbO2 will go here. HbO2 will start coming to the veins. So that is the mechanism of action of hydrogen cyanide poisoning. And please remember that the most common cause of hydrogen cyanide poisoning is fire. So if you can see, I have in the diagram, I have shown you three kinds of fire. In these two are occurring in the closed space, and this is occurring in the open space. In the open space, there is sufficient oxygen. So complete combustion leads to CO2 production. Whereas in other closed spaces, there is insufficient oxygen. So incomplete combustion. Incomplete combustion. So what happens is, in case it's a fire in the buildings, commonly cyanide gas is produced. So carbon dioxide is not produced because oxygen is led. And in case it is in home, in home we get carbon monoxide. So in the home, carbon monoxide will be produced. In buildings, industrial buildings, carbon cyanide poisoning will be produced. Cyanide gas will be produced. Why? Because they uses many nitrogen because these buildings use many nitrogen containing synthetic fibers. Nitrogen containing synthetic fibers are used in these buildings. This is the most common cause is the fire in the buildings. Then sometimes the salt of cyanide, which can be used for suicide, etc. And then cyanogenic food, example, bitter elements. So these are the bitter elements which can cause cyanide toxicity, but these are the normal elements that we eat usually. So they does not cause cyanotoxicity. Okay. Presentation, they have a characteristic bitter element smell. Very important. They can cause weakness, neurological issues and cardiac issues are the two things. Headache actually can occur in anything which causes hypoxia. That causes CNS vasodilation, which can lead to hypoxia. The neurological and cardiac issues are the fatal period. If it is in liquid or gas form, it is very rapid. Within few minutes. If it is solid, then it occurs in about half an hour or so. Cyanide is extremely volatile, so the viscera has to be kept in airtight bottles. Now, treatment, please remember, these are the 5 main antidotes. As I told you, this hydroxycobalamin is the best. Hydroxycobalamin is the best, and please remember the first 3: amyl nitrite, sodium nitrate and sodium thiosulfate. These are the part of the traditional Lilly cyanide kit. Okay. Now, hydrogen cyanide, methemoglobin and carbon monoxide. So here I have hydrogen cyanide, I have already told. Methemoglobin, the mechanism is that the Fe2 plus is changed to Fe3 plus, because of which two things in the hemoglobin, Fe2 plus is changed to Fe3 plus. Because of what happens is, first of all, the oxygen carrying capacity of the hemoglobin decreases. Second thing is oxygen binds. So oxygen, first of all, it will less amount of oxygen will bind to hemoglobin, and whatever oxygen binds, that binds tightly. So both the things happen. First of all, less oxygen binds to the hemoglobin, and whatever oxygen binds, it binds tightly, so the hemoglobin is not able to release the oxygen to the tissues. Same problem occurs with carbon monoxide. So in carbon monoxide, because carbon monoxide combines with the hemoglobin, so this COHB causes two things. Same thing. First of all, less oxygen is able to combine with the hemoglobin, and second thing is the oxygen, whatever oxygen combines, that binds tightly with the hemoglobin, so it's not able to release. Hydrogen cyanide, I have told you the main cause is fire, etc. Methemoglobin occurs due to various drugs, example isosorbide, nitrite, etc. Nitrites, etc. Carbon monoxide, we know it is fire, etc. Color of the blood in hydrogen cyanide poisoning, it will be cherry red and similar color like brick red, bright red. Carbon monoxide also cherry red and similar color like brick red or bright red. Methemoglobin is totally opposite. It is dark chocolate brown in color. So the blood is dark colored in methemoglobin. Other two, it is very bright reddish. So that is the reason, because here in hydrogen cyanide and carbon monoxide, the blood is reddish. So cyanosis is not seen in this. But because in methemoglobin, the blood is dark. Dark blood means cyanosis. Dark blood itself means cyanosis. So we will not go into detail. Just remember one thing, that Oxygen is not useful in cyanide, it is not useful in methemoglobin, but it is useful in carbon monoxide. Just remember this point. Oleander poison is of two types, white oleander and yellow oleander, that we have discussed already. The active principle in white oleander is oleandrin and nerin, and in yellow oleander is thebatin, thebatoxin and cerebrin. Please remember that the mechanism of action of all cardiac glycoside, whether it is digitalis purpura or oleander, everything is same. What is the same? Or digitalis, everything is same. Inhibition of sodium potassium ATPase. This leads to hyperkalemia, and hyperkalemia leads to multiple features. So heart failure, arrhythmias, all these things occur. Aconite is also called monk's hood or meetha zahar. Why it is called meetha zahar? Because the root is sweetish in taste. Because the root is sweetish in taste, extremely poisonous. Root is the all parts are poisonous, but root is more poisonous. The main thing is it activates sodium ion channels, which leads to stimulation. So here one characteristic symptom you have to remember, that there is tingling followed by numbness in extremities. That is the one characteristic feature of aconite poisoning, that there is tingling followed by numbness and the person remains conscious, and then there is hippus, alternate contraction and dilatation of pupils. Alternate contraction and dilatation of pupils. Okay, now some miscellaneous compounds like organochlorines. So please, here I would like to tell you one thing. Anything which ends, they are all used as insecticides. Whenever anything ends with NE or IN, NE or IN, that will be organochlorine. Andrin. Andrin is also called plant penicillin. The mechanism of action is they cause prolonged opening of sodium ion channels in neurons, which leads to CNS stimulation. And another thing is it accumulates in fatty tissues. Okay, and please remember the general treatment is similar to organophosphate poisoning, but you remember one thing, that in organochlorine we give one special treatment called cholestyramine. Cholestyramine. This cholestyramine is a bile acid sequestrant. It attaches with the bile acid. Organochlorine also attaches with the bile acid. Okay, organochlorine also have an affinity towards bile acid. So what happens is when cholestyramine attaches to the bile acid, this becomes non-soluble. It becomes non-soluble and is excreted out into the feces. Treatment given in organophosphate but not in organochlorine is atropine and pralidoxime. These are given in organophosphate but not in organochlorine. So how do you remember? Organochlorine. Chlorine. It has C. Chlorine has C. Organochlorine. C is there. So C for organochlorine. C for CNS stimulation. C for CNS stimulation. Again, C for chubby. Chubby means fat. It deposits in the fatty tissues. And then again C for cholestyramine. Cholestyramine. Okay. So this is how you can remember. Pyrethroids, they are also same mechanism of action as organochlorine. They are least toxic, like good night, all out. That's the reason they are least toxic. We use them in our households. So whenever anything ends with thrin, that will be pyrethrins or pyrethroids. So please remember, organophosphate is something which has phos in it, or which ends with on. So phos-on is organophosphates. Here the mnemonic is carbs are mine. Organochlorine, anything ends with Ne or In. Pyrethrin is anything which has thrin in it. Okay. Aluminium phosphide or zinc phosphide, both are rodenticide. So aluminium phosphide, both of them have exactly same features and same mechanism. So both of them, what they do is they release phosphine gas in stomach. This phosphine gas has two mechanisms. First of all, it inhibits cytochrome C oxidase. Like in cyanide toxicity, it also inhibits cytochrome C oxidase, but at a slower speed as compared to cyanide. And then it also causes oxidative stress. So it is also by that means also it is cytotoxic. The key clinical feature here is profound hypotension. That is the main thing. Profound shock occurs. The treatment is just supportive. And again, the smell I have told you, the characteristic fishy smell, that was the most important, very characteristic. Cannabis causes AMO and AMO. Amotivational syndrome. Person loses interest in all activities and run amok. Person kills anyone who comes in contact with him and then finally kills himself. AMO is in cannabis. Chloral hydrate. So please remember one mnemonic, that Mickey Finn knockouts by chloral hydrate. Remember this mnemonic. McKiffin knockouts by chloral hydrate. The mixture of chloral alcohol plus chloral hydrate is called it can be called McKiffin, or it can be called knockout drop, because the person becomes suddenly unconscious and crime can be done. Lathyrus sativus. So active principle is beta oxalyl amino alanine. So remember this, Lathyrus sativus. So it has double S, Lathyrus sativus. So it causes symmetrical spastic paralysis of both the legs. Symmetrical spastic paralysis of both the legs. Psychedelic, they can cause other perception disorder also, but because they are mainly causing hallucination, so that's the reason psychedelic are called hallucinogens. The most common is vivid visual hallucinations. These are the different examples. Please remember the first four have similar mechanism. They affect the serotonin receptor. But the last one, phencyclidine, is very different. It is NMDA antagonist. Like example, ketamine is also NMDA antagonist. The main feature of NMDA antagonism is they cause dissociation. Okay. LSD key points. L for long-term effects. It has very long-term effects. S for it interferes with serotonin receptors. And D for dorsum. Dorsum means back. Back means, so from back you remember flashback. It causes flashback phenomena. Then phen causes den. D for dissociation. E for erratic posture with catatonia. And nystagmus. Okay, so phencyclidine has different kind of features. Sewer gas occurs whenever there is a decaying organic material. Gases are relatively less toxic. The person dies only if he works there for a very prolonged, if there is a very prolonged exposure. Otherwise, these gases are not that toxic. Only if there is a very prolonged exposure, person's working in sewer for a long time. So CHAMS, remember the mnemonic CHAMS. So another thing that you have to remember is these are less toxic. That means carbon monoxide, cyanide gas, these will not be